One morning, you try to speak, and your voice is gone. Or maybe your leg suddenly gives out entirely. Or a violent tremor starts in your hand and refuses to stop. You rush to the emergency room. Your mind instantly races to the worst-case scenarios: a massive stroke, a tumor, some kind of catastrophic tissue damage tearing through your nervous system. The medical team leaps into action. They draw vials of blood, check your reflexes, and roll you into the MRI machine to pinpoint exactly where the physical break occurred. But then the doctor returns with the results. The blood work is flawless. The scans are perfectly pristine. They can't find a single anomaly. Instead of feeling relief, you are handed the most damaging, dismissive sentence a patient can hear. It's all in your head. You are dropped into a medical vacuum. Your limbs are still shaking, your voice is gone, yet the people supposed to heal you seem to imply you are choosing this pain, or worse, making it up entirely. You survive a terrifying bodily failure, only to be told your suffering is imaginary. The medical system has inflicted a second, entirely preventable trauma. There is an actual modern medical diagnosis for what is happening to you: functional neurological symptom disorder, or FNSD. The symptoms of FNSD are 100% real and completely involuntary. You are not faking a tremor. You are not imagining the weakness. You aren't choosing to be sick. Historically, doctors referred to this condition as conversion disorder, a confusing label that often caused more misunderstandings than it solved. The onset usually traces back to a specific biological trigger. Most patients experience a prolonged stretch of intense psychological stress or carry severe unresolved trauma. When the nervous system absorbs too much psychological distress, it becomes completely overloaded. Unable to process the emotional weight, the brain involuntarily translates that distress into a physical symptom, one that you cannot simply switch off. FNSD is an overwhelmed nervous system, desperately attempting to communicate extreme distress. Those perfectly normal test results from the emergency room actually tell a different story. They do not prove you are healthy. They are a required diagnostic criterion for FNSD. Imagine a computer, physical hardware on the left, software code on the right. A clean MRI proves your body's hardware, bones, muscles, brain tissue, is perfectly intact. FNSD is a software glitch. The brain's signaling pathways are misfiring from stress overload, causing physical system crashes. A clean medical scan should never end a doctor's investigation. It merely proves the hardware is fine, directing the medical team to immediately treat the functional distress in the software. Because FNSD is a functional issue and not permanent structural damage, it is highly treatable. Treatment relies on two distinct pillars. The first is physical or occupational therapy, which works to retrain your body's movements and mitigate the immediate, severe physical symptoms. This Venn diagram shows the second, equally vital pillar of treatment: psychotherapy. As the two circles overlap, we see that addressing the underlying trauma causing the nervous system to misfire is what ultimately leads to complete recovery. For this dual care approach to succeed, it must be delivered by a medical team and licensed clinicians who genuinely believe your lived experience. Coping and healing counseling provides the exact specialized psychotherapy required to address the traumatic roots of FNSD. They operate with a culturally competent team of over 15 licensed therapists, serving all 159 counties in Georgia through a completely HIPAA-compliant telehealth platform. Care is financially accessible. They accept major insurance plans like Aetna, Cigna, and Humana, and $0 copays for Medicaid. True healing from FNSD begins the moment your care team stops doubting you, treating your mind and body as a connected system.